DISC, is an instrument that we recommend, we use with all of our clients, that helps you in so many different ways in the practice. It's a psychological test that helps you better understand how people think and how people behave. And there's lots of others that are similar to it. Colby, for example. And I think you're pretty familiar with the Colby. What do they call it? A test? What do they call it? Colby?
Yeah, they call it an assessment.
Colby assessment.
Yeah, Colby is about your instincts. In other words, how do you naturally, automatically act?
Right. Another is Myers-Briggs. If anyone ever took a Psych 101 class in college, you probably heard about Myers-Briggs. There's others that are in the similar vein. Left brain, right brain is one. Red, blue is another one. Warm, cold is another one. And it all relates to how the brain works. And what the concept is behind this is, when you understand what makes people tick, it allows us to connect with them and communicate with them more effectively. And by coincidence, I was introduced to DISC 41 years ago now, Naren. It was 1982. Wow. And I have quite literally taken hundreds and hundreds and hundreds of CE hours on the DISC, the DISC personality styles. So because I'm so familiar with it, that's what we introduce to our clients. And in fact, if any of our listeners are new to the concept of DISC, we have an episode that we did on our Thriving Dentist Show, our flagship podcast called the Thriving Dentist Show. And it's titled Unleashing the Power of DISC Personality Styles in Your Practice. And I had a guest on the show. His name was Chris Licurdo. Chris Licurdo is considered by many to be the world's foremost expert on DISC. And he's someone I've taken a lot of hours of CE under. So I invited him to come on the show, and he completely adapted DISC to a dental environment. And you're going to hear it on that podcast episode. So we'll put a link in the show notes. And it's titled Unleashing the Power of DISC Personality Styles in Your Practice with Chris Licurdo. I would strongly encourage anybody listening to this to go back and listen to that one as well. It's free and a great way to really kind of get command of what DISC is all about. Now, let me fast forward a little bit, and it has to do, there's 4 different possibilities of personality styles. And the letters D, I, S, and C are the labels for the different personality styles. So D, you tend to pick adjectives that describe the characteristic of that person. They're drivers, they're dominant, they're decision makers. Those are Ds. I's are influencers. The I's are the people persons. Now, I realize that people person doesn't start with I. Influencer does, but people person does describe who the I's are. I'm sure, Naren, you can think of someone that, if I say, Naren, name someone you know that's a people person, and it instantly comes to mind. Right. Those are the I's. The D's and I's are dominant on the right side of the brain. They're creative. They make decisions very quickly, and they don't need much information. The S's and C's are on the other side of the brain, the left side, the analytical side. So we have the creative side and the analytical side. The S's and C's are on the other side, the analytical side. S stands for steady, stable. So again, I pick adjectives that start with S to describe them. They are dear people, the S's. All the personality types are great. There are no bad personalities, Darren, but the S's are especially appealing. They're wonderful people. They're loyal. They're faithful. They care more about you than they care about themselves. They're caregivers. They do not like conflict. They will walk 100 miles around conflict and deal with it. The D's have no problem with conflict. Right. And so, again, things just to know about them. So DISC, C's are cautious. Good way to describe. They're the engineers of the world. Many of them are actually engineers by job. They just gravitated towards their personality. If they're not an engineer, they behave like an engineer. Now, here's a real easy way to understand this. This is like, when I say this every time, the light bulb goes off. The D's and the I's just want to know what time it is. They want to know what time it is. The S's and C's want to know how the watch works. Let me give an example dentally, clinically. If the patient has a missing tooth and you're recommending an implant, remember the D's and I's just want to know what time it is. So the D's and I's want to know, how soon can you get started on the implant? How long does it take and how much does it cost? That's all they want to know. All right. Now, don't bother telling them how the watch works because they don't care.
Right.
The S's and C's, on the other hand, want to know how the watch works. So let's tie it back to the implant. They want to know, well, how does the titanium screw osseointegrate into the mandible? And what material is the tooth made of that attaches to the titanium screw? And are there 10-year studies on the tooth material? Better yet, are there 20-year studies? And are there other choices of materials that we could use? And try not to be judgmental now as you're dealing with S&Cs, because they can't help it. That's how they are. They want to know this stuff. And if you stick with them and answer their questions, they can be some of the best patients in the world.